Welcome back, everybody, to another episode of the Chasing Edges podcast. Got Dr. Ken Kinakin on today. He's an Ontario-based chiropractor who's also a lecturer. He's been a powerlifter for a long time, and then he is the founder of the Swis conference. The Swis stands for Society of Weight Training and Injury Specialists, and it's a really cool event where they share all the information online as well. But they bring the best in nutrition, all recovery modalities, doctors, therapists, and then the best weightlifting professionals and trainers in the industry. And they bring all this information together and, again, share it with the masses. So it's a really cool product. It's a really cool event. But here he is sharing information, and we start with the importance of that and the importance of specialization, where there's problems now where a trainer or a personal trainer or a doctor try and be the master of everything and give you all this information. So we emphasize the priority of being great at what you do, master your niche, and then use professionals outside of that, because it's hard enough to already master one thing, let alone 20 things in the world of performance. It's a complex world. So from there, we move on to the importance of assessment, which is using these professionals. And I think athletes and Gen Pop and everybody should do it anyways. Before you go into new training, before you go into another off season, get right and get your foundation strong. Make sure you have no asymmetries, weaknesses, and those kind of things, or at least know where they're at so you can train them and communicate that with your trainers. But he has a really cool assessment strategy where he starts to look at these levels of dysfunction or like these injuries and issues you do have, and how to properly assess them. And that's one of my favorite things on the podcast. But he breaks down and categorizes these issues by are they do they need reconditioned? Are they dysfunctional? Are they damaged? And then he also breaks down whether or not they're local issues, regional issues, or central issues. So we get into the neurology, and that bleeds into a fun conversation of some of the modalities. One of my favorite modalities is the MPS Dolphin. We talk in depth on it, but he uses it to treat some brain trauma and things along those lines, and gets into this really cool concept of battlefield acupuncture, where they've used that in real time to buy more time, reaction, energy, things like that. And then from there, I speak on breath. He asked me about breath a few times, trying to simplify it and get the most information out with the simplest problem solving, which is obviously breathing less, and nasal breathing, which I go very in depth on. And then that bleeds into probably one of the things I'm super excited about to try myself, but that is metabolic function. He uses lactate testing to do so, and it makes a lot of sense. And I've flirted with a lot of different training styles and training volume, which is really interesting, and how hard do I train and what's a safe zone. And I've heard different things on like the Huberman podcast about zone 2 conditioning and things like that. But like lactate, the lactate threshold makes a lot of sense to me. So I'm excited to dive into that, and hope that you get a lot out of the conversation on it as well. But it's a fun conversation. He's incredibly intelligent, has an incredible resource available to you. The links are in the show notes, and I hope you enjoy. Dr. Ken Kinakin, thank you for joining me.
Thank you for inviting me. This is going to be fun.
Yeah, for sure. I think your name's been dropped on here at least 2 or 3 times by Doc, and then last episode with Doc, I think he even threw your office phone number out there. So
yeah. He says, I just gave him your phone number. Be prepared.
Yeah. But no, I'm excited to talk to you just because we've already covered a bunch of topics since you were in town for the Arnold Classic here. Yeah. But how I always start this off is just trying to pick out where you're curious and where you're chasing edges right now. Like, what are you learning? What's got you down a rabbit hole right now?
Yeah, the biggest thing that I've found is really the information. We've gone in from a information tsunami. There's just so much information that is out there. And, you can grab your phone, and you can get as much information as you want. The challenge being is that what is the actual solution? And so I'm gone from just giving information to how do you take that information into an actionable step. And especially in my specialty, is weight training, sports medicine. So I've competed in powerlifting for, over 40 years. I'm actually getting ready for a powerlifting competition in June. So
let's go.
I'm 59 now, and I've been doing it for years and years. And you can do it intelligently. You can do it, for a long time. don't really have a lot of pain, but you need to restore the body through a number of different things. And some of the mobility information out there is really good, but some of it is also over accentuated in the sense of this is all you need to do. You don't need physio, you don't need chiropractic, you don't need medicine. You just need to, roll around on a ball or a foam roller, and, the tissues will magically, redevelop into something that is the way that it used to be, which in reality, especially when you're a competitive, lifter, doesn't happen. It just really doesn't. So my goal is always to have the fitness professionals work with the health professionals and to get really good, the best type of information, because the challenge that you have with a lot of fitness professionals, strength conditioning, is they think that they can actually fix everything through exercise. And then you have the other side where you have the health professionals that if you just do this treatment or take this drug, that it will take care of it, not considering there is a rehabilitation on it. So it's a spectrum, it's a continuum that you want to work with, and just to network with other people. Last year I do a large symposium for the past 20 years, and Swis, and it stands for Society of Weight Training Injury Specialists, and really trying to educate people on all the different modalities that there is in treatment and also in the exercise world and what is most appropriate. So that's been an ongoing, aspect, and trying to also put it online and educating people.
Yeah, that's awesome. And for those of you listening, the Swis conference is basically this bridge between the two, we'll call it ends of the spectrum, or at least the athlete and the doctor therapist, which is really cool because it eventually gets all this information, whether again, it's nutrition, it's training, it's rehab, it's different modalities such as laser, acupuncture, all these crazy things. And it's a really cool online product, but it's also an incredible conference. But I just admire the fact that you are trying to bridge that gap, because it is hard as like a normal person, like just absorbing all this information online, whether it's via social media or an online bot program, because usually you're going to get some type of bias from those people. And it's never like completely abort chiropractic or anything. It's everything, viewing everything as a whole. And now how do you go from 0 to 1? Like, how do you take the right first step with the right foundation? And I think that's really important too. So so besides like getting like the right people, what have been like your next steps on after that? Is just relaying the information in like a organized structure, or like what are you doing right now as far as like taking that next step to get it to the exercisers of the world?
Well, I'm basically just trying to get the information, and there's 3 different groups. You have the weight training athlete, you have the strength coach or personal trainer, and then you have the doctor and therapist. And we all have to know our own boundaries. We have to know what we're good at. And what I'm starting to see more is that you see, whether it be a personal trainer, strength coach that decides that they're going to do rehab and clinical nutrition and get someone ready for a powerlifting competition and get someone ready for a bodybuilding competition. It is so difficult to just do one of those properly. So I've been teaching different people on what is your niche? What are you really good at? And you've been playing professional football for a number of years. You actually have coaches for a specific position, correct?
Yes, sir.
Yeah, and that is so powerful, and that's the model that we need to really work with, is that become really, really good at one thing, not everything, because you can't, and you won't be the go-to person for that. So because the past 2 years have been devastating, especially here up in Canada, I'm just outside Toronto, is that, the gyms have been closed for a couple of years. And it's, I have so many patients that lost their gyms, personal trainers that basically left the business because they haven't been able to work for 2 years. The gyms were closed. They weren't allowed to be open. I know it's a little different in the United States, depending on which state, but the whole challenge is that how do you rebuild that network? How do you work with that? And so I did about 70 interviews last year. I called it Swis 2021, and it was all virtual and online, and just educating and just asking all the top people. A John Meadows. I did the last interview before John had, a week before John unfortunately had passed away. But, I talked to Dave Tate, I talked to Ed Cohn, a number of these different top, lifters, and, Dr. Stu McGill, some of these different doctors that were out there. And what does it take to get a referral from you? What are you looking for in that person? And a lot of it is that it's the specificity, become really good, because the biggest challenge that you have with most strength coaches or personal trainers or gym owners, I have a clinic, and, I have personal trainers walk in, leave their cards at the front desk, tell my front desk staff, you know what, have Dr. Kinakin, send all his patients to me. I'll take good care of them. Number one, I don't know who you are. I don't know what you do, and I don't even know how you do it. So it's basically, you need to develop a professional relationship in order to get a referral from us. And there's different steps and processes that I've been teaching for quite a while, but that is going to be the biggest push probably in the next 2 to 3 years, is how do you build these networks? I have 20,000 patients. I can send a lot of people to someone if I know who you are, what you do. Are you a nice person? Do we connect? I have a certain personality, and do we connect personality wise? Because if we don't, it's not going to work. So that's one of the biggest things that we're missing. Too many people are trying to do everything just because they think that they can. But, if you have a quarterback coach who's going to try, and teach, receivers, can you do it? Yeah. Can you do a good job? No, the receiver coach is completely different than a quarterback coach. Am I correct?
Yeah, I mean, obviously there's some crossover, but yeah, like that. I'm a big believer in the specialization as well. Like, I mean, in general, like in our lifespans, like we have the opportunity to get really, really good at like a handful of things. Like I got really good at football for a while, and then now I'm trying to get really good at like breath work and mental skills, because they just kind of go hand in hand.
Yes.
So yeah, but like it's funny because like as a trainer myself, or coach myself, a lot of my world and the breath work translates into like posture, or the ability to brace, or CO2 tolerance, or aerobic capacity. So that a lot of questions stem from that are like, how should I breathe in this position? Should I time this up with my pitch here? And those kind of things. So like really quickly, like you get really pulled very subtly into areas of shallower water for myself. Like intuitively, I can like intuitively try and solve the problem from like my general understanding, but it very quickly gets into like, oh, now like I need to teach them trigger pointing, and like that's not my specialty. I know about it, but or like now this muscle's sore, their test is low, and like anything everything's just compiled. So like I think it does take, as a coach, takes a high level of awareness to be able to say like, one, like I don't know. I think people are so scared to say I don't know now that it's like it's such a problem. And then like, even if you look at that, like I heard this, I think it's, I know it's a bad reference, but Kanye West, he basically said like, if you go through life trying to give everybody the right answer, like life's a test. Like, so I really like that perspective, because like when are you the most stressed out and worried about what's going on, or like the result is when you're taking a test, like elementary school to college or MCATs or whatever it is, like you're putting yourself in an anxious state to be perfect and answer right every time. Like I think people should be pushed towards the I don't know, or like, hey, like even like a disclaimer, like this isn't my specialty. In my network, I have these people. I got Dr. Ken, I got Dr. Serrano, and that's what I try and do for the most part, unless I know, tried and tested something myself. And then I just, it's just disclaimers. But like, that's why, but like to your point, like COVID probably killed some of the networking ability. And like, I respect the hustlers that are dropping their cards off at everywhere and trying to get as many clients as possible. Yeah, that's great too. But in the same essence, like you got to understand the respect level of the person you're asking to do that. And like, so you got 40 years of experience that you can't just hand away because you've met a grinder. Yeah. Like, so like I see all the points you're making, and I vibe with them, but I just, I'm interested to see where the specialty keeps going, for myself included, just because like, because I want to talk about this on the podcast as well. Cause like, yes, I love breath work, and I think it's just a missing niche in performance in general, even in general health. Like if you I'm finding now the chiropractors I like and like other performance specialists, they're tailoring it. Like there's strength coaches that are teaching them how to properly breathe when they're doing the 225 bench press test. Dylan Seeley is down regulating his patients before they get onto the table, so they have a chance to be more relaxed before he has to adjust them, so they don't work against the muscle mass. But then like that has bred my curiosity, because like obviously the effect of the breath on psychology. Now I'm in the brain, and then now if I start talking breath to contact sport athletes and military, brain health is important. So like I guess to my point, like I think it's okay to be incredible at one thing, but I do want like a deep enough water knowledge of the brain and like overall exercise. Like I don't think I'll ever be like a programmer for strength, but I'd love to be like this breath brain health concept guy. But anyways, that was just me ranting. Because like I just do think that is a great note, because a lot of trainers and strength coaches do listen to the podcast. So I think overemphasizing the networking and be really great at what you do, and like never be bigger than your job. If you are a personal trainer, you don't have to be a chiropractor too and try and adjust hips or solve all these problems. But I mean, we could talk about that whole mindset for a while, but as far as like because like you have access to some of the greatest humans in performance and recovery methods and nutrition, all this kind of thing. So I kind of want to pick your brain all over the place if you're up for it.
Yeah, absolutely. And I just want to emphasize that, as a strength coach or as a personal trainer, it doesn't matter if you do fascial stretch therapy or muscle activation, or you're going to use a foam roller or use, bands or tubing or a Swiss ball or any of these other, modalities that are out there. Definitely use that first, because I mean, you're not going to hurt anyone doing that. The whole thing is that how successful will it be? If you get stuck, then that's when you need to bring someone in to, who has access to and is within their scope of practice, to be able to look at the body differently. Where is the dysfunction? Because a lot of times we think that if we just strengthen it, that it should be better. The challenge being is that we don't know why it's weak. And there's three main reasons why it's weak. Number one is that it may be just deconditioned. And this is the general population. They're just, and so exercise, rehab, all of that will work fantastic. The next level is dysfunction. The muscle is too tight. The joint is restricted. It doesn't move as well. There's an aberrant neurological firing. So you can have a muscle problem, a joint problem, a nerve problem, or possibly a combination. That's what we tend to see. So that's where some of the strength coach and personal training modalities can make a difference, but a lot less. And this is where the therapists, the doctors can go in, manual doctors, such as chiropractors, such as myself, such as a physiotherapist, a massage therapist, an osteopath, athletic trainer, all the different, regulated professions. And then you have it's damaged. You got basically a torn meniscus, you got a torn labrum, a massive disc herniation that, you just literally can't even stand. That is something that may need a surgical intervention. And then you backpedal it through and you start working with the different rehab specialists in that. And then you can work with, the trainers, just because they don't have the knowledge base that we would, because we spent so much time in school and learned different systems on that. So that's the way that I always think, is that I'm always looking for a muscle problem, a joint problem, nerve problem. Is there a combination of that? And is this something, because I refer out all the time there, people come in and they're like, my back's bothering me and all this, and I'm like, great. And I'll work with them and I'll do acupuncture and active release and adjust them and do laser and MPS Dolphin and all these different modalities on them. And I say, okay, now you need to go see a strength coach or personal trainer. And now I start working with them saying, here are the exercises that I recommend, see how they work. Because I mean, I'm not there. I can't see whether or not it'll work as well. And also start, training with the trainer. And then I get feedback from them. You know what, this was good. Let's try this. Perfect. And it's always it's a continually evolving type of situation. And especially when you're dealing with high level competitive athletes, whether it's in a sport or whether it's in a competitive, powerlifter or bodybuilder, just because they're maxing out. And that's the whole thing with weight training, sports medicine, is that it's a completely different injury than, say, football or hockey or anything else, where it's more of a compression or a shear type of injury, because they're just with the speed and the velocity and the movement. With powerlifting, if you want to see things get exposed really quickly as far as where your weak points are, throw a few 100 pounds on your back. You'll find out really, really quickly.
Yeah, no doubt. And I've been, like, my journey into powerlifting has only been going on for about a year and a half, but knock on wood, I've been lucky as far as that, because I've tried to do some of these preventative things. But just to backtrack, because I think that's an incredible point for multiple reasons. One, before we get to, I guess, athletes in general, but the assessment tools are massive. The assessment tools of a personal trainer, a coach, a doctor, anything. Like, I think me personally, I think everybody should start breathing correctly before they do anything in general. Instead of just walking into your local CrossFit gym or gym in general and just start, I'm hurting and I'm sore. Like, that's supposed to happen. Then you start building dysfunction or strength on top of dysfunction. Then eventually, if it's a month later or 2 years later and you're trying to figure out why you got hurt, you don't know. And
right.
So what assessment, recommendations would you make for coaches and trainers, or just someone, general person walking out the street that wants to start training?
The biggest thing you can do, and I do this with all my new patients, is that as soon as they walk into the clinic, I watch how they move. How do you sit down? How do you get out of the chair? And then I'll take a history, and I basically explained to him, I said, listen, we're going to do an assessment. What that will entail is a number of different things. The first thing I'm going to do is just watch you walk. I want to see if they have low back pain, and if they basically have shoes. I just had a patient in last week. Her shoes were completely broken on the one side, which was the same side as she had back pain. So I looked at it, and I had her take off her shoes, and she went, oh my God, I didn't even notice, because the tread had completely worn down, and she actually had a bad ankle sprain. So her perineal muscles on the outside of the leg, because of the sprain, had never been strengthened. Huh. So basically said, number one, get new shoes, which she's like, oh yeah, absolutely. And number two, let's fix the outside of the leg, and then we'll see how well it works all the way up. And so I deal with that a lot. So that's my very first thing, is I want to see how your body moves through space. How's your head tilt? Where are your shoulders? Everything else. I check range of motion. But the big thing that I find, especially in the powerlifting world and in the weight training world, is I test muscle strength. So I want to find out what is strong and what is weak. And if it is weak, there's three main reasons. Number one, the muscle, there's something wrong with it in the sense of it's either shortened or not firing correctly. The second, or damaged. The second is the joint is not moving correctly. So if you have an AC joint sprain, the lateral deltoid is basically going to be inhibited. The third is the nerve supply. And the nerve can get compressed in a number of different areas. The neck, the upper back, underneath the collarbone, the subscapularis, it can go all the way down as far as having some different nerve entrapments. And so now we actually have to address that. And if there's anything coming off the spine, the joint is fixated, it doesn't move as well, it can be aberrant inhibition, meaning that you won't have as much strength. So if I test someone's lateral deltoid and it's weak, but everything else is pretty, intact, I'm like, okay, so I'm just going to do, some work on that. So I might use the MPS Dolphin and do some acupuncture work. I might, use percussor and release that. I might use, a laser and do that. I might put some acupuncture needles in, do some active release, and then retest it and see if it's strengthened. But if I see that it's the lateral deltoid, it's the bicep, it's the forearm extensors, it's the hand, everything is weak, that usually shows me we're dealing with more of a neurological issue. Because if you have shoulder pain and even your wrist extensors are weak, that doesn't make any sense, other than there's probably something coming from the neck or the upper back. And if we can release all of that and strengthen up everything along that whole nerve pathway, then we actually see some results. But if you just work on it locally, I always think this way: am I dealing with a local problem? Am I dealing with a regional problem? Or am I dealing with a central problem, or a combination of all three? And I worked in a chronic pain clinic for 5 years with 13 medical doctors, where these were really, really bad cases. You know, someone fell off a building 5 stories and landed on their back, and they're never going to work again. The brain actually changes structurally if you've been in pain for longer than 6 months. So you're highly sensitized to movement patterns and everything else. So in order to change that, you need different input into the head. The biggest one is breathing.
Let's go.
Change everything going through. The other one that we're utilizing is the MPS Dolphin. And you can use a protocol, and you saw that with Dr. Serrano.
Yeah, can you describe the MPS protocol real quick? Or sorry, the MPS Dolphin protocol.
So this is a electro stim unit. And in the acupuncture world, you know, there's stim plus, there's a number of other ones. And the really good part about this is that it has 3 different polarities. So you got negative, you got positive, and biphasic. Biphasic is both. And so what you would do is you would go in, just want to see if I can do it, and I'll just turn this on. And so you would go in, and I could find the point. And so this point right here, it's called large intestine 4. And so now I can stimulate that point. This is a very good point for headaches, because it draws the energy out of the head and brings it down into the hand. So I can stimulate that point. They've recently, so this unit here is the only unit in the world that has been recognized to treat COVID-19. Health Canada approved it last year. And how does that work? Basically what you do, and this is the protocol, it just came out with it, and it's called, has to do with the vagus nerve. The ear is innervated by a number of different cranial nerves. So I have direct access into the brain. If I can stimulate these different nerves, the biggest one is the vagus nerve. If the vagus nerve is highly stimulated, overstimulated, you're in a sympathetic stress. So you want to decrease the sympathetic stress on the actual body. And you can do that in a number of ways. You can treat the ear with these 5 different points, which is these points right here. This is called battlefield acupuncture. And these 5 points were created by out of Walter Reed Hospital with this one medical doctor who's also a PhD, that they would actually stimulate these points in battle. So they would knock people out of shock and maybe give them another 5 minutes, you know, of survival so that they can actually fix it. Because if you're in a sympathetic storm where everything is just fired up from shock, you have, it's very difficult to recover from that. So you can stimulate these points. I was involved in one study, and this paper that I was involved with, it actually got acupuncture paper of the year, where they used it for concussions and PTSD. And what we would do is that we would measure 18 lead EEG basically on the head, plus we measured their cortisol and also had them fill out a form as far as how they felt. So we would do it before the treatment and then also after the treatment. And the results were outstanding, like the sympathetic stress. So this was for battlefield acupuncture. So after this, just doing these 5 points on both sides.
Yeah. So just for you listening out there, he's just referring to 5 points on the inner ear. I don't know the ear anatomy, but it's just like inside of the lobe of the ear. Yeah.
Yeah. And so the sympathetic stress, this is in 5 minutes, 5 minutes of treatment. was reduced 27%. Cortisol was reduced 14%, improving heart rate variability an incredible 42%. And so all these different things really made a huge difference. They also found that cardiac marker, arterial blood flow marker, improved 48%, suggesting the role of the battlefield acupuncture in post cardiac surgery. But how this actual unit works is that you use these different points, and also you clip it to the ear, and then you also have it onto the stomach. So the vagus nerve goes from the head all the way through the entire body, through the thorax, into the abdominal area. And what they found was a decrease in sympathetic stress, vagal tone, which decreased the cytokine storm. And that's what they found with COVID-19, is that you would have a cytokine storm, you'd have an inflammatory response. This reduced it. So this has been a game changer. And as far as chasing different ideas, this one is also very good for scars. So if you've had a scar from surgery, or even a scar that doesn't necessarily have to be cut, basically be traumatized. So say you got a helmet into your shin as far as playing football, that really hurts.
Yeah.
So you would have a scar underneath the actual skin, even though it wasn't broken. And so you can treat that. And with this unit here, I've been able to make scars disappear.
Let's go.
Yeah. So it's wild. So you can decrease the impact on the brain, especially for PTSD, especially for concussions. They're starting to utilize it a lot more in all the different sports. And the only way you can actually change the brain is there has to be a different input. So you can either do it through the ear, you can actually have lights, as far as flashing lights, that can actually change it. They're doing what is known as transcranial magnetic stim. So they find the focal point, and the UFC and MMA fighters been utilizing this a lot, where they find the area where it's been traumatized, and then they use this transcranial magnetic stimulation to help heal the tissues, in that. So it's incredible as far as the amount of energy that you can put in and make a real big difference.
Is that a particular machine that they use for the transcranial work in the UFC?
Yeah. They're out of San Diego. There's a number of them. And Joe Rogan actually interviewed a number of fighters. And I forget, her name is Kat. I forget, she's a MMA fighter. She was a world champion, and she was dizzy and couldn't function, classic concussion, type of problems, forgetful. And once they started treating her brain, she a huge difference. So the therapies that are coming out are starting to be very powerful. The diagnostic skills are starting to be very powerful too.
Yeah, I love talking about this stuff, just because I think it's been avoided for way too long in the combat sports, and then obviously with the military as well. So in reference to the Dolphin and concussions, like, what is it, just the vagal tone that's improved, or is it blood flow? Like, what does the Dolphin do in particular for concussions, or is it the same as the battlefield acupuncture concept?
Well, so with the Dolphin, with the, and you can use acupuncture also. The challenge that you have with just doing needles, and I do acupuncture every day on my patients too. So my idea is I want to use as many modalities as possible. And if I can get 10% out of this, and 10% out of active release, and 10% out of laser, and you can build up, a number of different modalities. I'm not attached to a certain technique or idea or concept or anything else. All I'm interested in is, does it work? Am I working on the right area? And so it might be breath work. Guess what breath work does? And learning on how to breathe. It changes your sympathetic stress. It drops it down. So I agree with you in the sense of you need to be able to learn how to breathe. And I'm glad that you're doing that. I have a number of other friends that are getting more and more into the breathing and the bracing and understanding the breath work. It's been around for literally hundreds, if not thousands of years with yoga. Yoga is not just a certain pose. It's an actual, you learn on how to control your body on a number of different levels. And especially with these yogi masters or Qigong. I've worked with a lot of Qigong masters. Very, very similar, understanding energy.
What's Qigong? Sorry.
So so the body, depending on which culture that you want to work with, we all have different concepts of what energy in the body is. So in India, it's prana. In China, in Japan, it's ki or chi or qi, ki.
Yep.
And so it's basically your own vitality. And their understanding is that the ki energy, the chi, is actually stored in the kidneys. And so as you start to drop, it's called organ reserve in Western medicine, where if you stress the body over and over and over, the reserve of the energy in the actual organs decreases. And there's different ways you can measure that. They use biochemistry as far as are the enzyme systems working, how functional it is. And we find that when people are ready to pass, usually the last organ is the kidney. As soon as the kidney, if you're in kidney failure, very, very difficult to help restore. And a friend of mine, Charles Poliquin, talked about this concept as far as the yin and the yang and the lamp. And what happens with a lot of athletes is they're very yang. They're always pushing. I'm going to, have this stimulant and Red Bull and all these other supplements that, continually drive. And that's the flame on the actual, oil lamp. But we're missing the oil. So that's all the restoration. Breathing is part of the restoration. How do you bring down the system? How do you replenish the body's energy, whether it be esoterically with the ki and chi and everything else? And you can do it through acupuncture, do it through pulse magnetic field, meditation. It's just dropping yourself out of that continual drive, because you can't keep it. Because if you keep the flame going full blast, you're going to run out of oil. If you don't have any oil, things crash. So you need restorative type of treatments. That's why Dr. Serrano, I was at his clinic when I was at the Arnold. I couldn't believe the amount of things that he had in there. He had 2, hyperbaric chambers, the giant ones.
Yeah.
That's storing the body's energy in that. He's got that. You threw me on the pulse magnetic field table, had me jump up and down. He cranked it up so
yeah.
But I mean, these are all different things that you can help restore the body. And so it has to be a good balance that you're able to crank it when you're ready, but you also need to restore that and recover from that. And I think what's going to be happening, and I'm starting to see this trend more and more and more, is that it's not just about training, it's restorative work. And you're doing some fantastic work through mindfulness, through the breathing. That's all restorative, which will help you on the field. Because if you're always tired, overtrained, cranking it all the time, that's where you get into injuries. So you need that combination of that. And so there's a lot of different units that are able to do it. And you just got to have that time to make it work that way.
No doubt. I'm a big believer in that balance for sure too. And that's why I've talked about this with a bunch of people, but like, why would you not invest, like, especially if you're a professional athlete, why would you not invest X amount into your body, into your health? Because that's what's making you your money anyways. Or like, but even in the concept of a college athlete, like, why would you not chase enough edges to balance that? And like, some of it's ego. And I wanted to get back to this anyways, because an athlete coming into an off season, same as the system's already changing, like the assessment of the system needs to change or needs to be checked. It's like a checkup. So like, and people do it and like I don't want to say they disguise it as GPP, but like, all right, we're going to start with another GPP phase and keep going. But like, that doesn't assess the system beforehand. It's still like I'm kind of in this phase too. Dylan put me on a book where like you look at the system as a whole. And basically like the problem with the system is that no system's like certain complete. And like, obviously a lot of the athletic strength programs is like not a one size fits all, but it's the same programming for 100 different people, 100 different sizes, 100 different sleep patterns, 100 different stressors,
Yeah.
So the program's not going to work effectively or at a specific level for everybody. so like the personal assessment needs to be very high. But I try and push athletes to, like, every offseason before you get back going, like, recheck in, go to your doctors, find your foundation where you're at right now, your asymmetries, your weaknesses, your damage, whatever, and then push forward. Obviously, like, you're on the same page there.
Yeah, yeah, and probably even more so because my assessment system is a lot of muscle testing. So I try and determine what is strong, what is weak. And if it is weak, why? And what I found is usually three reasons. Number one, the muscle is dysfunctional for whatever reason.
Yep.
Second is the joint is dysfunctional. It's not moving correctly, which may be impacting the nervous system. So I'm always walking in with that model as far as, am I dealing with a muscle, joint, or nerve problem, or a combination of that? And just in the past 2 weeks, the biggest challenge with muscle testing is that it was a qualitative test, meaning that it was a yes, no. Either it's strong, and what I mean by muscle testing is, you push up, and if you could push up with 20 pounds, I could match that, and then maybe give it an extra, 5 pounds. So now I'm pressing down maybe 25 pounds. And if it's intact and you can basically ramp up your system that you can isometrically hold that position, then I would say that it's a strong muscle, it's intact, it's fully facilitated.
Is there a particular system that you favor? Like, obviously, like, a lot of the pro sports teams fall to the FMS test and, like, the NordBord testing and things like that. Like, obviously, like, that's a decent baseline, at least
Yes.
mobility. Do you support those, or do you recommend anything else when, like, reassessing an athlete going into a season or anything?
Yes. Well, the biggest thing is, and I think you saw me doing this with working with different people when I was at Serrano's, is you want to find out what is weak and why, and what will actually work to basically, at least you'll be able to contract it isometrically. The challenge that we had with muscle testing is that it was a qualitative test, yes, no. Now I had some other units, and they were $2,000 or $3,000, and they were not easy to work with. I just found a new unit that is not as expensive and is Bluetooth to my phone, so I can actually measure the amount of force. So if I'm testing someone's quads and they have problems on the right hand side, and I test it and it's 30 pounds and it goes down, and on the other side, on the left hand side, I test it and it's 50 pounds, and it's isometrically holding, I can't push them. So then what I do is I do all my therapies and everything else, and I retest the muscle, and now it's 50 pounds. So I'm using more force, and it's actually holding in that isometric position. So that's one of the great things that's going to be coming down the pipeline, as far as, if you're wondering, as far as what I'm chasing right now.
Yeah.
That is one. In fact, for the past 2 years, I was working with some different engineers to try and figure out how to put it together, because I wanted it Bluetooth, so that the person, and when they're on the table, I give them my phone and they can actually see the amount of pressure, and they don't think that it's me. Because the problem with muscle testing, oh, you're pushing harder, that's why my arm is down, or my leg. They can actually see the numbers. So I'm taken out of the equation now. And now,
that's awesome.
Okay, so this is really good. So I'm going to be building rehabilitative programs with this, but I've gotten away from testing muscles, and I'm more interested in testing the plane and range of motion. And what I mean by that is that for the bench press, I used to teach, we're gonna check the pec sternal, and so you internally rotate, so your thumb is down, your arm is out in front, and you want to try and bring it across. Well, you don't bench press like that. So I'm interested in, as far as getting you in the bench position, and can you hold that position in the different positions of the bench press? So now I can actually find where the deficit is. So we do the same thing as far as, I worked with some hockey players, and I watched them, some NHL hockey players, and I watched them on the ice and how their leg actually moved. The guy always had a hamstring problem. And so I tested in the standard hamstring position, as far as it looked like a leg curl, but I noticed that his leg was turned out and externally rotated when he was skating. So I got him in that position once I saw how he moved, and all of a sudden it was weak. Here's the wild part. I could only get it strong when I treated it in that plane and range of motion. If I went back to the standard way where it looked like a leg curl and not externally rotated or abducted, it didn't work as well. As soon as I got in that position and worked that, and I don't know why, I think it has to do with something with the brain, because now I'm also reconditioning the brain. And guess what? Guess what his rehab exercise will be? It's not going to be doing simple leg curls. It's going to be strengthening it in that plane and range of motion that he had the weakness and deficit, not necessarily because of a massive, injury as far as a torn muscle, but more proprioceptively. Again, we're impacting the body to see if we can actually change the brain, because motor patterns and pain is perceived in the brain. And so if we can change that, and that input and external input, I think that's where we're going to see things going. And again, it's more definitive. And now we can actually measure that. And they're coming out with a new unit, this company that I'm going to be working with, I think, that not only tests the muscles as far as the actual strength that will be Bluetooth to your phone, you can actually, it's an inclinometer. So now you can actually test the ranges of motion and see the actual differences that you can do. The more that we can measure, I'm a huge advocate of let's test everything. NOR-board, FMS, tissue palpation. It doesn't really actually matter. Ranges of motion. All of that is another piece of the puzzle. And then you get into imaging, the X-ray, the ultrasound, the MRI, which is a static picture. And a lot of people diagnose off of that. You can't necessarily diagnose off of that because it's only a static picture. It's not moving. It's not, you can't necessarily test that, but it gives you a huge amount of feedback that you may have not seen before. Like, oh, like my L3, I couldn't figure out why my low back was, unstable all the time. And I'm doing all this stability work and, ball work and on the floor and all this other stuff. I go get an X-ray, and from the side, a lateral X-ray from the side, my L3 spinous process is fractured in 3 places.
Huh.
Why? I don't know. I've been in a few car accidents, so people always run into me. That's why I drive a big truck now. So yeah, my L3 is fractured in 3 different places. So these bones are floating in space, and guess what attaches in the low back to L3, spinous process? Pretty much all the low back muscles. So I'm already working at a deficit because it's, it's difficult. It's trying to like playing pool with a rope. It just doesn't work as well. So, but I'm trying to stabilize it as best as possible. And I've created different protocols for myself so that I can deadlift heavy. So I can deadlift, or squat heavy, and do all these different exercises. So that's going to be coming down the pipeline where we're going to be able to measure the actual strength deficits. And then if we can throw a surface EMG to see, so now we can correlate the problem with surface EMG, which measures the amount of muscle contraction, but does it really measure force? Well, now we can combine the two, which will be pretty cool.
No, I like that. Yeah, I've used those before for like quad VMOs and those kind of things, especially.
Yes.
Like, yeah, that's the only time I've really seen those for the most part. But I'm a big believer in measuring, tracking, and getting information as fast as possible. That's why I think velocity-based training is awesome right now, too, just to give people instant feedback on every rep, ranges, effort, or nervous system state. So now you have these instant metrics, and I think that's awesome too, just because it'll be able to give people tangible things. And I'm a believer that like what you measure, you can track. So if we can track as much as possible, so we should measure as much as possible. And then eventually now we have enough data, at least make a decision. It's not like what happened? And like this was asymmetrical for so long, or this was weak for so long, probably what happened, it just gives you a better chance at solving problems.
I agree. It's, I think the biggest example that would be is that, what's your blood sugar level right now? How high is your cholesterol? I don't know. You need to get it tested. Should I be on cholesterol medication? I don't know. Depends on what the actual level is. Now, first I would start with diet, and then supplementation. And then for whatever reason, if you, want to take a statin, you can. I went to see this medical doctor, and, my cholesterol was a little bit high. So he says, well, I'm going to recommend some, statin drugs. I went, no, you're not. He says, well, why? He says, I'll just clean up my diet. He went, oh, okay.
Yeah. Yeah.
Why not start with the basics?
No, I mean, some doctors, like, if your only tool is a hammer, everything looks like a nail. So give medicine to everything. And
Yeah.
like, but all that, like, just being with Serrano, I'm super biased.
Yes.
But like, even like the level, like, and me and Serrano talked about this on one of the podcasts too, that like the levels of cholesterol are like, it's like a 2,000 calorie diet thing. It doesn't apply to barely anyone in
Yeah.
essence. So like, just because it's above this, and then like all the blood testing, they have different ranges of what's healthy and what's not, whether it's testosterone, cholesterol, all
Yeah.
those things. So like, just because it's above, I get to prescribe you this medication, and you can, but the fact is you can say no. But like, also cholesterol is like very important for transporting and creating hormones. So like,
Yes.
high cholesterol is not a bad thing. Now you have to look at the whole system as a whole, like, again, all your lipids, like, again, hormones, everything. And if everything's not functioning properly, yeah, like, but like, if high cholesterol and your body fat's good, every other hormone and vitamins good, you're fine. Like, it's not going to cause a heart attack or anything. It's just like,
And
that
the type of cholesterol and whether
Yeah.
or not it's oxidized. Like, I mean, it just, the more that we get into this with the cholesterol and the science, just seen more and more research that is very specific and ones that aren't even really talked about, you know. So it's the more specific that you can understand, the more powerful it becomes.
Yeah, no, I completely agree. Then,
Excuse me.
yeah, no problem. We've talked about a bunch of concepts as well, but I think we hit the assessment pretty good as far as like the modalities. Like, and some of this may be like a cost issue with people, which is why like the personal trainers become the do all, or
Yeah.
the foam rollers that answer to everything.
Yeah.
As far as like cost effective modalities for health and maintenance for like a weightlifting human, what have you found to be like your favorite easiest modalities that are accessible to most people?
I think the biggest thing is just finding someone that can walk you through a good assessment, find out where your deficits are, and then based on their education, that they can show you specific stretching or types of stretching. There's so many different types that are out there. Some of them involve someone else, so fascial stretch therapy, you know, FST is really good, but you need someone else to do that. I'm a big proponent of dynamic type of stretching and also warm up as opposed to just strictly static. So that would be one thing. Foam rolling, especially for the back, and what I do, and I actually foam roll probably 3 or 4 times a day when I'm in the clinic. The reason being is because I'm bent over all the time and I'm dealing with, you know, neck optional people that are, you know, over 300 pounds. You know, it's really hard on my system. So I put a foam roller on the ground, and I just roll back and forth, and I mobilize my thoracics, my lumbar region, just to try and make sure that the tissues, number one, are good, but also the actual vertebrae. I want to continually keep motion and movement in the vertebrae, so I won't sustain an injury being bent over in that area. As far as something that people can do at home, I think breath work would be fantastic. Everyone is so stressed out. It's just incredible. So, you know, any of the courses or any of the, what would you recommend as far as breath work? What have you seen or what have you come out with that you would educate people with?
Again, I think it's like the very simple first steps is like, and honestly, like if people are just getting into strength training or after like a long lapse or they've never done it or anything like that, like solve your breath first. Like if you have no cardiovascular or pulmonary conditioning, especially the respiratory muscles and things like that, you're going to go get your ass kicked. Like you're going to get your ass kicked and you're not going to breathe and brace properly. Like you don't, and you're like, once those muscles fatigue, like your core stability is gone. Like you're like, particularly, I mean, you're a chiropractor, so you know that like the diaphragm and pelvic floor are very important for the alignment and stabilization of the spine. And so in the breathwork world, the easiest way to give somebody a minimal advice is say, breathe through your nose. And then after that, it's breathe slow. And so like in the simplest sense, like the first thing that's easiest is solve your sleep. So solve that. Make sure you're a healthy, functional breather while you sleep. And a healthy, functional breath is through the nose. It's a low breath. That people call it a diaphragmatic breath. Like obviously breathing through your mouth and nose both use diaphragm. But you want a low horizontal breath. It needs to be low and light. It shouldn't be a hard grasp. It shouldn't be any of that. But so solve your sleep first, because that's unconscious. So the whole goal is to make this breathing that's it's part of the autonomic nervous system is going to work regardless if you're thinking about it or not, is make as many of your breaths conscious. So and to make them conscious, they should be in through the nose unless you're fighting somebody. Other than that, there shouldn't be another state during the day where you can't breathe in through your nose. And some of it, and people are running into obstacles because they've been a mouth breather for 20 years, or they have sleep apnea, or all these things. So it takes time and patience, and because like the nasal cavity, and if you read some of the books like the Jaws and the Breast and those kind of things, but a lot of the research shows like that your nasal cavity, you can return size to it with use. It's like if you don't use it, you lose it concept. So it might take a week or 2 weeks or 3 weeks of this consciousness, nothing crazy. Just even if you're just watching TV or at work, close your mouth. But like, so that's why we solve sleep first, because we use mouth tape. And if you're not used to the mouth tape, tape your mouth an hour before you sleep, open up the nasal passageway. A lot of the drainage and the clogging and all those kind of things, people just don't understand it properly. So I'm just breaking down the two things, like breathe through your nose and breathe slow. But breathing through your nose, each nostril goes in waves of which side's contracting and which side's releasing to keep the membrane and the tissue inside of the nose healthy, because it'll dry out and crack, and like you want it to be moist and again clean, humidify the air, all those things. So people always think, oh no, my right side's clogged. No, like that's your nose doing its job. It's taking that nostril's taking its break, so the other side can and getting healthy while the other side takes control. You can get plenty of air in through one nostril, but people, or if they're both clogged, it's just a lack of patience. If you only give your body one orifice to breathe through, if you give it about 5 minutes, it's going to accelerate the drainage or anything like that, because your body's going to survive. You might get a little sympathetic for a second, but then you'll calm back down. But give it 5 minutes and your nose will clear up 30 to 50%. Just like that. You can do little holds and stuff too. I'm not going to go down all the coaching points, but so an hour before bed, tape your nose or tape your mouth so you breathe through your nose and it's comfortable, it's open. Then try and sleep. Make sure you don't have a big pillow contracting the front of the neck or anything like that, and then just see how you feel. And so usually, like when we're asking people like about their breathing, like the first questions are, do you wake up with a dry mouth, and do you wake up to piss at night? Because like if you're breathing through your mouth all night, you're still in a very low tone of a sympathetic state, and like that your digestive system won't shut down completely. So it's just like a unknown common thing where like there's other things that affect that as well, but like this is a main thing that we've seen go away with a lot of our athletes and a lot of people we've recommended this to. People dream deeper, because like again, the nose is parasympathetic, the mouth is sympathetic. So I want to breathe in through my nose when I'm sleeping. That makes the most sense. Rest and digest isn't the AKA name for the parasympathetic nervous system. Makes sense. Let's rest how we're supposed to breathe. So if you solve that, now let's solve your consciousness during the day, because like everything can throw us out of state, like stress, all these man-made stressors, an email, a text, an action-packed TV show or drama, driving. The human brain's not supposed to go 80 miles per hour. Like that's sympathetic, or like, and granted, like a lot of our input anyways has become predominantly visual, but visual is another effect on your state. So again, like if I'm fighting you, I'm staring at you, I'm staring at my phone, same concept. If we're focused on one thing, it's still a sympathetic state, or at least a cue. That's why like peripherals, like if you want to like amplify your state and get calmer, open up your peripherals, slow your breath, breathe in through your nose. All these things just are compounding to control your state. But like, so if you can breathe through your nose while you sleep, now you breathe through your nose as much as possible throughout the day. And the goal is, again, pull it into consciousness until it becomes unconscious. And there's compounding benefits, because like obviously the nose is a smaller orifice, so it's actually going to strengthen the diaphragm. It's going to strengthen your respiratory muscles, because you have to pull in harder, exhale harder. So you're strengthening inhale and exhale muscles. So like over time, like give it a month, give it 2 months, maybe 6 months if you have a lot of breathing issues, and just like make it a game, whatever you have to do. But like those compounding strength issues will slow your breath. The smaller orifice makes it slower to come in, slower to go out. Like we speak about like the heart and the lungs being a wind chime. And if they're out of control, your psychology recedes, like your psychological state recedes. So again, control this wind chime, and the nose naturally gets you there because it takes longer to fill up. And because eventually, hopefully you're filling up from the bottom up too. Like the top 25% of your lungs, like a reserve, and like your mouth, if you take a big breath into your mouth, it's short, shallow, like that's reserves. That should be used once all your other oxygen's destroyed. So,
Yeah.
or used up. So like all these things just kind of compound. And that's only just because I told you to breathe in through your nose. And then now if you consciously breathe slower, and like, cause like, I think the average person now breathes like 20 to 23,000 times a day when it really should be like 17 to 19. So like if you can, and like if you like, and you'll really, just the funny thing is like me and one of my buddies will like jokingly, like we'll be watching TV or like doing something or drinking coffee, and without telling the other person, we'll count their breaths in a minute and be like, hey dude, that was 17 breaths this minute, this minute, and that kind of thing, where it's just like you don't realize because it's not in your consciousness. So slow your breath, and like all the nervous system down regulations are just little tricks to like box breathing, 1-to-2 ratio, and inhale to exhale. All these things are just to slow your breath or get CO2 out. And so it's just like, because if you're breathing this top 25% of your lung, it's like when a little girl hyperventilates. The problem is not oxygen in the system. Like she's full, lungs are full. That you need to get the CO2 out or the CO2 present to absorb or to get the hemoglobin to dump and get the oxygen off the hemoglobin. So anyways, moral story is, when in doubt, slow your breath, balance it out, 5 seconds in, 5 seconds out, 6 seconds, 6 seconds out, or 1-to-2 ratio, inhale to exhale. That's your slow breathing. Or box breath, which is inhale is the first side of the box, inhale holds the top of the box, exhale hold. Do 3 seconds each side, 4 seconds each side, 6 seconds, whatever. So now you have nasal breathing and slow breathing. And now like that's the bare minimum. And the stronger the muscles, the better they'll perform in performance. Now performance is a whole nother ball game, but at least you have a shot at breathing right, instead of like walking off the street, being a mouth breather with sleep apnea that doesn't have any diaphragmatic strength or endurance. And then you just go get your ass kicked. And now you're wondering like, why do I even do this? My body hurts. I didn't get assessed, just like compounding.
What do you think of as far as with a nasal rinse to help open it up? Do you?
Good. Yeah. So I had Dr. Alan Butler on here on the podcast as well. And I call things the wrong name, and then I second guess my confidence. But yeah, so especially as you're starting to get into the nasal breathing world, yeah, even like pre-performance, that's fine. You don't want to abuse it. You don't want to use it all day, like anything like that, but use it pre-performance for a while until your nasal cavity starts to adapt. But you can use it before bed a little bit. I think he's done that. I'd have to look back at my show notes and those kind of things, but yeah, like so that, but then there's also like the nasal, so there's nasal rinse for health, or like for like saturation. Again, same thing as one of the nostrils shuts down so the membrane and the cells can like rehydrate and get healthy again while the other one works. There's just a saline rinse that's really easy.
Yeah.
And
that's what I'm thinking.
Yeah, but then there's also the medicine that's I always mess it up. It's just like it opens both sides. It's just a medicine that it's like a allergy thing. I'm blanking on the name, but okay. But anyways, like that, you can use that initially, like, especially because a lot of people like, so now, like even in performance, like you should breathe through your nose, like during your warm up and your dynamic. Cause like, again, like it's creating a little more CO2 presence, which is eventually leading you into a better state for aerobic efficiency and those kind of things too, while turning on these respiratory muscles a little harder. And it may make you breathe a little bit faster, but if you can stay through the nose, all these things compound into like a pulmonary cardiovascular warm up alongside your muscle and your tissue and everything too. So it's just like kind of like you can put water in your mouth and go through your dynamic and like then spit it out at the end, something like that. Those things are just fun little ways to like, again, strengthen, not neglect the lungs and not neglect the breathing as part of this dynamic warm up. Because it's kind of like when like a runner finds his stride at 7 minutes, 15 minutes, 25 minutes, you get your runner's high or whatever it is. You're like your pulmonary system and your lungs and everything need to get caught up to the warmth of that you already started. And then obviously eventually it becomes a bell curve where your muscles get too hot and they use too much oxygen. Obviously that's the downfall of VO2 max and things like that. But anyways, but like that's just how we approach it and how I think it's very smart to approach it. And then now after that, now there's all these exhale holding hypoxia tricks and
Right.
these ratios and hard dumps of oxygen. There's superventilation, hyperventilation. There's all these things to play with after that. But really, like this in the simplest form, breathe through your nose and breathe slow all day. Eliminate stress, like eliminate as much stress as possible. That way, again, event affects the vagus nerve as well, down regulatory.
Yeah.
Why would you not master a skill? Because like, again, like I look at it esoterically as like every human wants control. Like we get our most anxious and scared when things are uncertain, or and you can't even be scared of what you don't know, which is another little trick in psychology. But the uncertainty or change, or the attention and the spotlights on you, or whatever it ends up being, like we just want control in any scenario, any environment. So the one thing that people I think neglect is the breath, because that gives you this kind of like a gear shift system to upregulate and downregulate. So now you're driving your car of a human that you are.
Yeah.
And so now, like if you catch yourself mouth breathing, okay, downregulate into the nose, out through the mouth, extend the exhale. Now get to nose, and now get into first gear. Now breathe slower. And then it's just like, I can go up and down when I want. I need consciousness to it. But like a lot of people, and the more and more I read about the panic attacks and things like that, people feel them coming on, or people feel their anxiety coming on, and they either reach for a pill, or they like go like they avoid whatever else is stimulating. That's awesome too. But like, that's all external. Like get control of the physiology so that your psychology and everything can be as controlled as possible. And then after that, I'm not a doctor, so, but yeah, I just think it's logical. But I think the breathing's just super undersold, and that's why I coach it, because I think it's important. And it's and the more like I find the good doctors, like they're aware of the breath. They watch a person breathing while they're in there. And most people at the doctor are probably relatively sympathetic, because they're, again, the uncertainty of what's wrong with me. Can he fix it?
Right.
Will this pill work? Like all those things, like you can control some of that cortisol and that response and that vagal tone, and give yourself a chance. Because and I kind of joke around all the time. Like if I go through like a slow breathing protocol or meditation protocol with anybody, it doesn't matter if it's the right protocol or right for them or anything. Everybody feels better and more calm. And if not both. So it's just like, it's that powerful of a tool that it can like, kind of like, it's like a fix all for mild stress, anxiety, and things like that. But you have to buy in, and it just becomes meditative. You count your breath, or you follow your breath, and the mind can only really focus on one thing at a time. So if you're counting your breath, you can't think about the whatever the doctor's trying to say, or doctor's going to come back and say, or the email that you can't respond to anyways, or whatever the deadline. It's just like, I just think it's logical.
No, I agree. And it's, again, it's such a powerful, easy tool, but you need to be coached, and there's different ways of doing it, that way. The other thing, which is really interesting, talking about measurements, is I used to do it in the clinic, and we measured people's lactate levels when they were exercising. Because the whole thing is that what level should I be doing cardiovascular if I'm on a treadmill or a bike or anything else of that nature? And most people are on a treadmill to lose weight. Sports conditioning is completely different. But I had one presenter at Swis 2018, Ed McNeely, and he's worked with so many high-level gold medalists for women's rowing, a number of skiing sports, as far as biathlons and whatnot, and conditioning, and what heart rate should you be working at. And again, you can determine it. You can do a max VO2, or you can wear the massive metabolic cart, and those units are $30,000 to $50,000 for the good ones. It's getting cheaper as far as getting the metabolic carts. But the other way, we used to do this in the clinic, and my example for myself was that running. Like I couldn't run. I've competed in powerlifting, and so I skewed my body's metabolism one way. But if I get my heart rate up to 145, I feel like coughing up a lung. It wasn't working. So Scott Christie, who was working with me in the clinic, he got training with Ed McNeely on this, threw me on a treadmill. So what we did is we had me on a treadmill. We're starting walking 2 miles an hour. We take a pinprick of blood, looks like a glucose meter.
Yep.
And you take a pinprick of blood, you measure the lactate, which is about 1.2, millimoles per deciliter. It's just a measurement. And you're burning about 50% carbohydrates and 50% fat at that level. It'd be like you and I discussing. We take our lactate level to be about the same. 3 minutes later, we increase the speed to 2.5, still walking, take the pinprick of blood, 1.2, heart rate probably is about 100 at that time. We go to 3 minutes later, test it again. I'm still at 1.2. Heart rate is about 105, 107. We increase it to 3.5, still 1.2. And my heart rate goes to about 120. We increase it to 4. I'm still walking. I'm not even running. I'm walking fast now at 4 miles an hour. And my heart rate jumped to 145 and my lactate was 3.2. Scott goes, okay, test is done. And I went, I'm not even running. He says, you can't. I go, why? He says, you spent so much time in powerlifting, you've metabolically have shifted yourself that you can lift things, but you can't lift it that often. And so specific adaptation to impose demand because of my style of training, low reps, low set, heavy weight. I had no cardiovascular. I didn't have the enzyme system. I didn't have the mitochondrial index, a high amount to be basically to utilize fat as a source because I never trained it that way. He says, you're going to have to train at a heart rate of 127 and you're going to be walking at 3. And that will shift your metabolism so that you'll be able to build up the enzyme system. You'll be able to build up the mitochondrial index. And I went, oh, okay. So I started doing that. Huge change. We tested, we were running it in the clinic. We tested about 120 people in the clinic. I remember this one woman, Beth, she ate perfect. Her diet was great. Her training was good, but she couldn't lose weight. We tested her on the lactate testing. Her training heart rate was 95. She was so metabolically dysfunctional from a cardiovascular standpoint, we had to create a foundational base. And so it's a simple little unit. I actually picked it up at Serrano's place when I was down there in March, and I'm going to be reinstituting it and utilizing again because this 220 minus your age, that was just made up.
Yeah.
The military didn't know what to do, so they just kind of threw it out there, and for whatever reason, all of a sudden it ended up on every single gym, on the planet. And as far as that, so training the system, because everyone's like, well, how many calories did you burn? I went, I don't care. I'm more interested in if I'm on a treadmill for half an hour, I want to see what my body's going to do for 23 and a half hours laying around. Because am I changing the metabolic system? And there really hasn't been, you can do it through a metabolic cart. You can get what's called the RQ, where you can kind of calculate that too. But Ed has done probably, 500,000 lactate tests. He even worked with people that were going to climb, on top of Mount Everest and testing them there and all the different winter sports. And what he found is that when you're training, there's 5 different zones that you go through for heart rate. And he says, what you want to do is you want to build number 1. I don't care if you're an Olympic athlete, and periodically you train in zone 5. He said zone 2, 3, and 4, they found really did not contribute to athletic performance. And he says, especially for people that want to lose weight, you want them to change them. The purpose of doing the cardiovascular is to change the cell metabolism. It's not to burn calories. You do your workout and you have a sandwich, guess what? All the calories just came back. It's how do you burn it all the time? How do you change that metabolism? And so that's a new test that's coming out right now that's starting to people use.
What's the test? What's the machine called?
It's called Nova Biometrics, I think. I'll find out right now for you.
Yeah, that intrigues me. Just because I've listened to like the calories in, calories out argument a bunch and those kind of things, but it always does make sense to like just because that's kind of like solving your breathing during the day before you solve your breathing in performance.
Yes.
Yeah,
Yes.
so like that makes very logical sense to me. So I'm interested to see what my levels are at.
Yeah, and you know, you can yeah, it's called the Lactate Plus. So you can go to lactateplusmeter.com.
Nice.
And it's $312.
Nice.
And you get test strips for 25 strips. It's $48. So it's probably about $10 per test. But I would highly recommend it because, again, you don't know where you should be training cardiovascular wise. And then you can follow up every 4 weeks, every 6 weeks, and see how your training is. And so, you know, we have HIIT training or interval training. People are going fast and slow, fast and slow. And for certain people, if you're in shape, yeah, fine. Metabolically, you could probably handle it. If you're like me, if I was to do interval training, I'd die.
Yeah.
I get in the first, 2 minutes, and I'd be plastered, on the treadmill and flying backwards because I just couldn't do it. Now, can I pick up the treadmill? Yes.
Yeah. I've gravitated really heavy into the powerlifting too, so I feel you.
Yeah. So once I shifted over and I was able to measure, and it was really interesting. After about 8 minutes to 10-minute mark, you actually feel, and the same thing when you're doing breathing, you can feel a shift. All of a sudden, things have kind of clicked in. And that's the same way when you're training at the right heart rate and you've been measured and you identified it, because no one knows. It's no different than measuring your cholesterol. What's your cholesterol? I don't know. What heart rate should you be training at? You don't know. So if you measure it, simple little unit, you can do it. It's no different than blood sugar.
You can track it and change it. Yeah, it's interesting. I'm gonna have to do some more research on that too, just because I listen to the Andrew Huberman podcast a lot too, and he obviously prescribes zone 2 training for X amount of minutes during the week and this kind of thing. So
yeah, Peter Attia, he's another one that he's talking a lot about it, and I think he tries to get at 2 millimoles per deciliter, I believe, to get the most out of his workout, but not overdo it and not burn out. So each zone has its own capabilities, but I think most people should start out at zone 1. You don't even know what zone 1 is.
build, find your foundation, then build on it. Yeah, that's same with breathing, same with the assessment. And then go and find a good foundation of people and doctors to use to assess all your stuff too.
Yes.
I feel like that's a good summary of the episode and the conversation. That's awesome. No, you're a stud. I won't take up too much of your time. I appreciate you hopping on.
Oh, absolutely. Love to do it. And next time I'm down in Columbus, I'll see if Eric and we can jump on a podcast with you, and
hell yeah,
we can argue about different things.
Guaranteed. Before we go, where can people find you? I'll obviously like tag you on the Instagrams and all those kind of things, but where can people obviously you have your practice in Canada and also the Swiss conference, if you want to tell everybody where they can find you. Yeah.
So probably the easiest would just be through Instagram, Dr. Ken Kinakin. I have a page there, or SWIS_ Dr. Ken Kinakin is the other one. And I put little clips every day from the symposium. So you can see Dr. Serrano talking about avocado oil for your face, or, I had Stan Efferding talking about walking after you eat, or, the step-by-step process, that Ed Cohn does for squatting. Or you can watch Kazmaier roll up a frying pan, on stage.
No, it's for everybody listening. It's dynamite content. It's very potent, concentrated clips that are awesome.
Yeah, I try and put as much information as I can up on that. And I'll be doing another Swiss symposium probably in the fall. Just working out the details on that. So I'll be announcing it there.
And then I'll pump that out on my Instagram and the Chasing Edges Instagram as well. So
and if you need to email me, I just go to drkenkinakin.com and we'll have the links there. And my website that has all the videos from the past 20 years of all the Swiss symposiums is swissvideoflix.com. And you can sign up. I use the Netflix model where you can sign up free for a week, watch as many as you want. And then if you want to, sign up for it, $7.98,
Awesome.
a month, and get access to all the top people in the world, people that you know and people that you don't know that you'll learn a ton from. So it's a great resource for anyone in nutrition, training, therapy. It has everything. I have Dr. Mike Leahy. I think he did 5 or 6 years with presenting for me. So all of his protocols for active release, and David Leaf doing all the different muscle testing, and Ed Cohn and Kaz and all the different characters. And Serrano was there endlessly. So of course, I mean, in all different types of superhero shirts.
Superhero or God, he's got one of the two on. But it's all the modalities are on there. It's a lot of great information. And one more time, what was that website?
It's swisvideoflix.com, and you can go there, and we'll have that in the show notes too.
Perfect. Yeah, you're the man. Well, I greatly appreciate your time and all the information. Yeah.
Oh no, it's a lot of fun. I want to be able to work with you more and help you promote whatever I can with the breath work, because it's so needed. It's just starting to take traction now. We're starting to see more and more doctors talking about it. Jordan Shallow is another one that is talking about breathing and bracing, how it applies to weight training. So we're going to be seeing it more and more out there. And I'm glad that you've kind of taken it upon yourself to also implement it, for athletes, but even the general public. Everyone should be able to learn how to breathe and breathe properly.
Guaranteed. Yeah, I preach that gospel as much as I can. Yeah. Well, again, appreciate you.
My pleasure. This was a lot of fun. I look forward to seeing you soon again.
Yeah, take care.
Thanks.
Bye.